Hey there, and welcome. If you're dealing with diabetes and that nagging, stiff, painful shoulder, then you are in exactly the right place. We're going to break down everything you need to know about diabetic frozen shoulder. And all the information here is based on patient guidance directly from Dr. Praveen Ramachandra, a senior endocrinologist from the Diaplus Endocrinology Clinic in Bangalore. So let's dive right in. This right here, this quote from Dr. Ramachandra, this is the golden rule. It is, without a doubt, the single most important message we're going to talk about today. It's the foundation for everything else, from how you recover to how you prevent this from happening again. Keep this in the back of your mind as we go. Now, check this out. 5 times. That's a pretty startling number, isn't it? It really drives home why this isn't just some random ache or pain. For people with diabetes, it's a very real and significant complication that absolutely needs your attention. So to make this all crystal clear, here's our game plan. We've broken this down into 5 simple parts. We'll start with why this happens, walk through what you can expect, and then, most importantly, focus on what you can actually do about it. Think of this as your roadmap to getting your motion back. All right, let's start at the beginning. Section 1, the diabetic shoulder connection. You're probably asking, why me? Why is this happening? Understanding that root cause is really the first big step toward managing it. So the main culprit has a pretty sci-fi name, Advanced Glycation End Products, or AGEs for short. But here's an easy way to think about it. When your blood sugar is high, that extra sugar starts sticking to proteins in your body, like the collagen in your shoulder joint. This process literally acts like glue, making that flexible tissue all stiff and sticky. That's the science behind why your shoulder gets frozen. Okay, so you know the why. Now let's talk about the journey itself. Knowing what's coming down the road can make the whole process feel a lot less scary and a lot more manageable. So let's walk through the 3 distinct stages of a frozen shoulder. So this whole thing usually unfolds in 3 phases. First up is the freezing stage. This is where the pain really ramps up, and you start noticing you just can't move your arm like you used to. Then comes the frozen stage. The good news? The intense pain might actually start to fade a bit. The bad news? The stiffness is at its absolute worst. But then you hit the thawing stage. This is the light at the end of the tunnel, where your mobility slowly, gradually starts coming back. Now, for diabetics, this whole process can take longer, but the key thing to remember is it does get better. All right, let's get to the good stuff, the part where you take back control. Let's talk about what you can be doing every single day to fight that stiffness and start reclaiming your movement. This is your daily plan for recovery. But hang on, before you jump in, a few really important safety rules. First, always warm up. Second, consistency is everything. Try to do these exercises 2 or 3 times a day. And please, listen to your body. You want to feel a mild stretch, a little discomfort, but never sharp pain. If it's sharp, stop. And because you have diabetes, it is absolutely crucial to check your blood sugar before and after you exercise. Of course, the best plan is one made just for you, so always try to consult a physiotherapist. Our first exercise is a fantastic starting point. It's called the pendulum stretch. This one is perfect because it's super gentle. You're basically using gravity to help you out. All you do is lean over a table, using your good arm for support. Let your affected arm just hang down completely relaxed. Then use your body to create a gentle swing, making small circles first one way and then the other. Next up, we've got the towel stretch. This one is a real game changer for improving that tricky motion of trying to reach behind your back. You just grab a towel, hold it behind you vertically. Your good arm grabs the top part, and your affected arm grabs the bottom. Then you just use your good arm to gently pull upwards, giving that stiff shoulder a nice controlled stretch. And our third key move is one I really like. It's called the finger walk. This is such a simple but effective way to improve your ability to lift your arm up in front of you. Just stand facing a wall, put your fingertips on it, and pretend your fingers are a little spider. Slowly walk them up the wall, going only as high as feels comfortable. Hold it for a second, and then slowly walk them back down. Now, exercise is key, but let's be real. Sometimes you just need to manage the pain. So what else can you do at home for some relief? Let's look at a few simple but powerful remedies. Think of it this way. Heat before you stretch helps to loosen up and relax all those tight muscles. Then a cold pack after can help numb any pain and reduce inflammation. Now, here's a really important note for diabetics. If you have any nerve damage or neuropathy, please be careful.
Test the temperature on another part of your body first so you don't risk a burn. And when it comes to pills like NSAIDs, you have to talk to your doctor first. They're not right for everyone with diabetes.
Okay, so you're doing the exercises, you're managing the pain, but what if it's just not enough? In our last section, let's talk about when it's time to go back to your doctor and discuss what the next steps might be.
So here's the timeline to keep in mind. If you have been doing your exercises and home care consistently, and I mean really consistently, for 3 to 6 months and you're just not seeing any real improvement, that's your signal. That's when it's time to have a conversation about other options. The 2 main procedures your doctor will likely talk about are these. First is manipulation under anesthesia, or MUA, where a doctor basically does a very deep stretch for you while you're asleep to break up that stiff tissue. The other is an arthroscopic release, which is a keyhole surgery to physically cut the tight capsule. Dr. Ramachandra's guidance often points to this one as the preferred option for diabetics. But remember, neither of these is a magic fix. Both require a lot of physical therapy right after to make sure you keep that new range of motion.
And here we are, right back where we started. This brings us full circle to the most critical piece of advice from Dr. Ramachandra. You can do all the exercises in the world, but if your blood sugar is out of control, you're fighting an uphill battle. Good glycemic control, which means keeping that HbA1c below 7%, is what stops those sticky, glue-like AGS from forming in the first place. It's the key to a faster recovery and preventing this from ever coming back. So, we've covered the why, the what to expect, and the how to fix it. You now have a solid framework, all based on the expert patient education from Dr. Praveen Ramachandra. So now the question really is for you. Are you ready to take this knowledge and truly take control of your shoulder health? Your path to feeling better can start right now.